All right, we're going to go ahead and get started. The reason I'm recording is we have one student that is out in quarantine right now that I don't want to totally miss this whole first part. So I told her that I would record it for her. So not my favorite thing to have all this going on, but we're going to make it work. I wanted to start today by talking about something that a lot of what we're going to do is based on, and that's the ATRA Code of Ethics. Some of you have already seen this in my other class. We may have talked about it, but it's always good to kind of know what these things are because we're talking about in this class what we're going to do as far as procedures, and that means what do we do with our clients and how do we do it in the best way we can. So in order to do that, we need to follow this ATRA. Is anybody know what ATRA stands for?
American Therapeutic Recreation Association.
There you go. They have, all right, we got some people here. Who we got? Gotcha. Let me get y'all marked real quick. All right, guys, we're just starting out talking about the ATRA, American Therapeutic Recreation Association Code of Ethics, because what we're doing in this class is talking about providing therapeutic recreation activities for people, and we need to do that in an ethical way as best we can. So I just wanted to kind of start with this before we even got into kind of the meat of the class. So the first one is beneficence, which is kind of exactly what it sounds like. We want to do things that are beneficial for our clients. We're actively making efforts to provide for their well-being while maximizing the possible benefits. That's basically what beneficence comes down to. Non-maleficence, that is simply put, we have an obligation to use our knowledge, skills, abilities, and judgment to help people while respecting their decisions and protecting them from harm. That's the number one key to what this non-maleficence means. We're protecting them from harm. We're not going to do anything that could hurt them, cause any sort of injury or damage. We have someone that we know has balance difficulties. As a recreation therapist, it is our duty not to, say, take them on a hike on loose, rocky terrain that's uneven, where they may fall. That's a situation where we are not, setting up for beneficence. We are showing some non-maleficence on that. Negligence, basically, putting them in harm's way. Autonomy, we have a right for our clients to preserve and protect their rights and to make their own choices. Once we put together for our patients, once we put together their individualized program plans, one of the things that happens, at least at most facilities, they're going to have to basically sign off on what you say you're going to be doing with them, which is their A-OK, I agree with this. A good thing in recreation therapy, and a lot of this happens up front, like we talked about in the assessment portion, you're going to find out what their interests are and what they want to do. And you can ask them, so since you like doing this, what sort of activities would you like to do? And you try to put those things in, which gives them this sense of autonomy where you let them have a choice in what they're going to be doing. That being said, when they feel like they have a say in it, they have a voice, they're going to be a lot more willing to participate. They're going to stick with what you're asking them to do a lot better because of the fact that they had input on what you're going to be doing. Next is Justice. This is a situation where you're responsible for ensuring that individuals are served fairly. And the key here is there's equity in the distribution of services. No matter how much you may try, if you have a caseload of patients, you're going to have some that are going to be your favorites. Just true. There's some people just like in regular life, you click with some people more than you do with others. So obviously, if Tia is my favorite as the recreation therapist, it would be more fun for me to do more activities and things with her than it would be for John, because he just gets on my nerves and he doesn't ever want to participate. In the code of ethics, that's something that we cannot do. We have to give at least an effort to give everybody fair treatment and the exact, a equal amount of effort on your part and treatment from you. You can't pick favorites and do that. Fidelity, simply put, it says to be loyal, faithful, and meet commitments. Meeting commitments is the number one thing that I take from this one. I think that is very important, and it's not just in recreation therapy and working with your patients, but I mean, especially there too. If you tell someone, hey, we're gonna meet tomorrow afternoon at 2 o'clock, and we're gonna play a game of bingo. Okay. Be there tomorrow afternoon at 2 o'clock and play bingo because you said that's what you're gonna do. Okay, that's basically all this amounts to. When you say it, you do it. Veracity. You need to be truthful and honest. Deception by being dishonest or omitting what is true should always be avoided. That's common sense. We all know that. We don't want to do that. Informed consent. That's kind of what I was talking about earlier. You need to have a shared decision-making process with your patients. I use the word clients a lot. I'm used to it. That's what they were at the NMRC where I worked. We called them clients, so I probably use that word just without even thinking. You are going to, now, there's situations where, let's say you have a surprise party for somebody. You don't have to inform them of that ahead of time, but they need to know what the plan is. They need to be informed what you're going to be working on. They need to know what is in store for them to a certain degree, at least in the form of, these are the type activities we're going to be doing. Doesn't have to be specific, but you just don't want to, they need to consent to things, because if you don't get that, you may get in one of those situations, like say where you wanted to have a day that involved going to the lake, and somebody had a traumatic experience where they nearly drowned, and they do not like to go to lakes. They wouldn't be a good candidate to go on this, therefore they would not give you consent that they were going to go. Knock that out ahead of time by going ahead and talking about that up front. Confidentiality and privacy, we all know what that's about. We have the obligation to show, to keep their information that needs to be confidential, and to not talk about things that we shouldn't talk about in places that we shouldn't. I had a coworker one time that went to lunch at a Mexican restaurant in town. And here they are sitting in their booth, everything's going well, they're eating. It's two coworkers. They're sitting there and they're talking about Timmy, the client that they work with. And they're talking just they're not saying last names or anything like that, but they have on their NMRC name badges, and they're just having normal conversation. They talk about how Timmy's just so frustrating in the morning because he won't get up and he won't do this. Guess who was sitting at the booth right behind him? Timmy's family. That ended up being a pretty big deal. That was a pretty good. That was like a slap on the wrist that they had to get a cast afterward. I mean, it was a pretty good slap. So confidentiality doesn't necessarily mean you're just broadcasting things out on social media or something like that. That even means when you are away from the workplace, be careful what you're doing. Competence, need to be competent in what you're doing. You have the responsibility to maintain and improve your knowledge related to the profession. That's, I think, a good thing to do regardless of what field you end up working in. You want to keep up with the current trends and keep up with new things that are being, shown to be effective. And 10 is obvious: compliance with laws and regulations. We don't want to do anything that doesn't comply with local, state, and federal laws and regulations, because if that one there, I can tell you, you'll end up looking for a job if you're not following number 10. So want to be sure to follow that. So I'll stop sharing that screen. I can't help it. I have to look and see how bad it is. Let's see. I can close that one. Let's talk now, actually. There it is. Share screen again for the recording. We're going to talk about chapter 1 real quick, or as quickly as I can. I want slideshow, but that needs to go away. All right. As I said before, any of you who haven't been here, be sure to get the book. You will need the book. It will be very handy for preparing for the test, because we can talk about a lot of things in here, but we're not going to be able to talk about every single thing that's going to be on the test. You need to read the chapters when I'll let you know which chapters are going to be on which test, when the test will be, all those good things, no big surprises. We will probably even have some sort of a review before we take the test. I kind of like to do that because I'm nice that way. Plus, I want you to actually, going back over it again, I want you to have stuff that you can take when you leave from here. I feel like if we kind of drill it in there a little bit, you might actually remember it. Let's skip this one. Basically, the purpose of the book, without even really reading this, is to give us some guidance on what procedures are used in the best manner for recreation therapy clients. Okay. That being said, it also goes over situations like helping us choose. How do we know which is the best? What is the best way to speak to our clients? Things such as that. The book has a lot of good information. It's all about how we provide recreation therapy intervention. We want to improve our frameworks for interventions by using the best evidence and theory. That kind of goes along with what I said a little while ago about keeping up with the current trends and keeping up with current topics that have to do with your profession. If we look and see that there's been a story put out that recreation therapists attempted to work on arthritis in the upper limbs by using aquatic therapy. And they have, this isn't a good example because it wouldn't be true. And they did not have results that would work. And we found another story that said that it was ineffective. Is that something that we would want to do? Or would we be just wasting our time, their time, holding the client back and making ourselves look bad? That's kind of what it comes down to. We want to use the best evidence and theory that's out there. The book has some good solid information that can improve your practice. All right, these are some things that this is pretty important. These are things that can improve the effectiveness of our interventions. Interventions are kind of the entire thing that we're doing, not just the activity. It's from the time we meet them to the time we have made goals and objectives, and we look to see whether or not things have come out to be effective. Okay. It's the use of evidence. It kind of cuts out doing things that don't work, and we can find situations where we've seen that this has worked multiple times in the past, so why don't we do a variation of this because we know it works? So evidence is great. There's also some theories. I think they're in chapter 2. Not my favorite kind of stuff to talk about because it's, all the different names of the people who came up with these theories. We'll probably have them on the test, but we're not going to spend a ton of time talking about each specific one here in class. That's something I'm going to kind of let you guys go back and look at and dive through that, because it would take a long time to hit each theory, and we only have a certain amount of time in class. Systematic program design. We'll talk about how we put together, program plans and how we write goals and objectives. And we talked about, briefing begins the therapeutic recreation session, and then debriefing is what occurs at the end. There's different designs, and it gives you the framework that you can work from and be effective. Another thing that improves the effectiveness is having continuous focus on client outcomes. That means we're looking to help them get better. We're helping to improve what we're working on. We are not focusing on, hey, I really just don't feel like doing much today. I can do bingo if I just sit up here and call out numbers. That'd be fun to me. We don't make choices based on what we want to do. We do choices based on what's best for the clients. And your effectiveness is going to be improved if you keep that focus on the clients. So as far as our strategy for interventions, we want to make sure that they're based on the client's needs. If you're into basketball and you are dominant right hand with everything, you can dribble a basketball easy. You try to do it with your left hand, starting off at least, a little more difficult, right? Which one would the client rather do? If we say, hey, we're going to do basketball dribbling skills today, which hand are they going to want to use? Their right one, because they want to show off and show you how good they can do it. We need to work on their deficits. We need to make sure that we are focusing on where they actually need the help. And I'm not saying, we're not training somebody to go to the NBA. That's an example of how you don't want to do things that people are super good at over and over. Yes, it would build morale to a degree, but you're not challenging them. They're not gaining a lot out of it if you're just feeding them things that they're already good at. You see what I'm saying with that? You need to make sure that you're working on their deficits. What's that? If somebody was really down and you see, because you can see your patients day to day, and you can read a lot by how they look and things like that. If you see somebody needs a morale boost one day, you set them up for success and make sure they're going to be successful, and make sure that they're going to be happy when they leave you and feel better and that may be where your success is that day. You may not improve dexterity in the left hand that day, but you may improve their psychological side. And that's something that we actually touch on in recreation therapy. Whereas physical therapy, you're talking about physical ailments and things like that. We talk about, in recreation therapy, we improve emotional state, social, socialization and things like that. So absolutely, if there are cases where we would let people do things if we see that it's still going to benefit them. That's the main key. Obviously, if they're based on these needs or deficits, we're designing programs that are implemented to improve, reduce, or eliminate those needs or deficits. We may not fix everything, but we want to at least improve. Situations like, say, a Parkinson's patient, it is progressive. You're not going to stop the progression of Parkinson's disease, but you can work on specific tasks and specific portions of their life and try to at least keep them where they are for longer. That's a success. Your goals may be to maintain the ability to walk up a flight of stairs. Walking declines with as you go along in Parkinson's disease. So a very good goal would be to work on something where you try to maintain their ability to walk as long as possible, or to load in and out of a vehicle independently as long as possible. Things like that. You want to make sure that what we're doing is targeted towards specific outcomes, and that plays into the goals and objectives that we've talked about, and that we'll get into more about. I said we're really going to stress writing goals and objectives and the proper way to do it. Goals are the big picture. Objectives are the small little steps that help you get there. That's kind of the key on that. So using goals and objectives, we're going to be working towards specific client outcomes, which are going to be the goals and objectives that we talked about. So, characteristics of therapeutic rec interventions. You want to be focused on a systematic assessment of client characteristics, needs, or deficits. So we are constantly, not just up front, not just at the end, we are looking at, progress or regression all the time. And we're looking at ourselves as, what can I do to better help this client? So you want to systematically assess what's going on as you go along. You want to design it in advance to be efficient and effective in its delivery. You don't want to just walk in and be like, I didn't show up today with nothing planned. If I did that, we'd still be sitting here and I'd be over here thumbing through this book trying to figure out what I want to talk to you guys about. Go ahead and plan ahead of time. That way, when you get there, you're not wasting a bunch of time, and you have already thought about how you're going to provide the activity in the best way, in the most efficient way. Because I'll tell you, if you mess around too long, you'll lose a person from wanting to participate. They're there, they're ready to go. And if you're just dilly-dallying around and not getting things started, they're just like, we're not going to do anything today. You can see them just click. You want to be able to produce targeted, meaningful, timely, and desired client outcomes. A lot of this is kind of being repeated. You want to just make sure that it's targeted. We're working on specific things. Timely, that plays into the fact that we want to have, goals and objectives, as we will get into, will cover that time frame we're talking about. It tells you, and your individualized program plans that we will talk about set the length of, a lot of places, individualized program plan is for 1 year. So that sets right there kind of your length of time that we're talking about. You need to be able to produce evaluation data indicating achievement or non-achievement of client outcomes. Okay, that's important. When we set goals and objectives, we are putting things out there that we want our clients to be able to show us whether or not they can do it. If they are successful on what we give them 10 out of 10 times the first day, what do we probably need to do? Make it a little harder. We need to step it up a little bit because we want to challenge them, because if they're bored and we're not giving them enough of a challenge, they're not going to focus in on what we're trying to get them to do. If they do it, 2 out of 10 times, what might mean we need to do? Make it a little easier, because if somebody's only successful 2 out of 10 times when they're coming to your activity, how are they going to feel when they leave about themselves? Probably not too good. Special Olympic basketball, they have skills days, and you have all sorts of athletes there as far as their level of how much they are affected by whatever's going on. Some of them have cerebral palsy. Some of them, are non-ambulatory. They're in a wheelchair. But one thing they do is called wall bounce, and they put a square on the wall, not quite as big as that periodic table there, but they put a tape square on the wall. And one of the things they do is they throw the ball. Now, for me and you, I can throw it behind my back and hit it in the box every time but they put a line on the floor. You have to stand behind the line and you throw it in the box. Just like a chest pass, basically. Okay, that sounds super easy to us. To somebody with cerebral palsy who doesn't have good motor control, things like that, they get up there and they try to throw it, and they throw the ball straight to the left and they miss. And they throw the ball the next time and it just dribbles like straight down. You probably want to take that line that they're throwing from, you want to pick up this paint and you want to take it 4 or 5 feet closer where they can hit that box. So, because it's far more important for them to have a degree of success, especially at a Special Olympic event. You want them to come out of that feeling happy, good, they had a good time, they get people to cheer for them. You need to be able to, really adjust the finish line is kind of what you're looking for to make it appropriate. If you move it up and they're hitting it just every time, boom, 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 then back it up a little bit. Work, make them work with what you're doing. The thing about it right here, it needs to be able to produce evaluation data that shows whether they achieved it or not. So that means I'm standing here, I'm holding a clipboard. Did they hit the box? Yes or no? Is that measurable? Absolutely. You need to have them doing things that you can either say, yes, they did it, or no, they didn't, because if you don't have that, then you have no basis for adjusting their goals and objectives, and no way to say whether or not you were effective with what you're doing. If it's not measurable, it's not something that you can track, okay? The reason that some of these theories we're going to talk about that are in chapter 2, the reason some of those are beneficial to us, reduces the amount of time and effort in creating things from scratch. We see something that worked, we may not want to do it exactly the way they did it, but it gives us a good idea of something that we can build from and make it our own, depending on our population of who we're working with. They may be doing it with a different population, so we may need to tweak it to suit our needs. Improves the connection between client's needs, program design and implementation, and client outcome. Basically, is saying by putting that all together, you're going to have better results. Improve standardization of and consensus about programs for specific client groups. Okay, we said, or I said last time in class, that no, we cannot have an obesity plan, that everybody we come in that's overweight, this is what we're going to do for you for recreation therapy. It's not, it needs to be individualized. It is not a cookie cutter thing where you just hand it out to everybody, okay? But when we have data to go by and things that we've seen evidence of, that they worked with the obese population and saw a reduction in weight by doing this, okay? That says, well, hey, that's something we can use with our people. Not every single one of them, but it takes that out of the equation and gives us at least something to start from, a starting point. And improves the ability to evaluate program effectiveness. So you can look at what you're doing based against some other things that have been done before. How effective is what I'm doing in comparison to what they did? Go away. By using evidence-based and theory-based programming. Okay, basically what I'm getting to with this stuff, y'all, it's and I really hate chapter 2. We're gonna have to go through it. I'm just telling you, it's just like history. It's not fun to go through, but we need to know history so we can learn from the past and not do the things that we did that were not effective, okay? This whole chapter is just talking about you need to pay attention to evidence that's out there that you can research and find. You know, you can look up treatment for fibromyalgia and find things to do for fibromyalgia patients and see things that have proved to you that they worked before. So the key is to take advantage of those resources that are out there and use them. You know, you're going to have team meetings where you're going to be meeting with other disciplines. You'll be in there with nurses and doctors and direct care workers and dietitians, and you're all sitting around a table and you're talking about what you're going to be doing with each client. That happens. Team meetings or whatever they're called at different facilities. You're discussing what you need to do with the patients. And you're going to say, well, this is what I want to do. And somebody's going to say, why? So if you've got some evidence-based knowledge from where you found this, or some theory-based, you know, hey, based on this that I read about, we've seen that this can be effective. That's why I want to do this, because you will be questioned on why you're choosing to do this or that or that. You need to have this evidence and theory there to help you justify what you're going to do, because you do get questioned. And it creates a common ground among therapeutic rec professionals and their colleagues from other disciplines, because you're able to do that justification that I was talking about. So when you have a systematic approach to planning your programs, there's some things that you are addressing by being systematic. You determine what the program is supposed to accomplish. You have a set of procedures to get to the goals, and you develop criteria to determine whether or not it did what it was supposed to do. In order to do that, you need to have objectives that are measurable to see whether or not people are meeting those. So, in a system planning model, you need to determine, you're going to look at your patient. You're going to have assessment up front. You're going to find out what they need. You're going to find out what they're great at. You're going to find out what they're weak at. You're going to find out what medical conditions they may have. You may see that they don't need to get out in the sun. You find out all these different things about your clients. From that, you determine your purpose as a recreation therapist. This is where I can step in, and this is where I can improve their life right here. So you determine the purpose, and then you form goals and objectives. Goals are the big picture. You want to improve cardiovascular functioning. Your objectives that you're going to come up with may be walking 100 yards 3 days a week. For someone who's in bad shape, that could be where you need to start. You know, and you're going to bump that up. You're going to work on those objectives as they're effectively meeting where you're looking for them to get to. You design a specific set of procedures and content to accomplish the purpose, goals, and objectives. Then you're going to have specific ways that you implement your delivery and the strategies that you use. Figure out an evaluation procedure. That's like I say, super important. If you don't have an evaluation procedure, you can't really say whether or not what you're doing is effective. So you have to find a way to know whether what you're doing is effective or not. Once you have that in place, you implement the program, and then you do the evaluation that you already figured out. This is how I'm going to see whether this is effective or not. And then once you get the data saying whether or not it was effective, you can revise the program like I said. Hey, it was too easy. It was too hard. They do better with outdoor activities. You know, things like that. You can change what you're doing once you get that evaluation data. We are almost there on this part, guys. Characteristics of your client outcomes. They need to be identifiable. They need to be measurable. Need to make sure that they're achievable. Need to make sure that it's documented. They need to be predictable. You know, since I'm doing this, I expect this to happen. That's basically what we're saying. If I do this, this is going to cause this to happen. So that's what predictable or causal is referring to. And obviously what we're doing with our clients, we want it to be meaningful. Okay? Now, I have one other thing that I want you guys to do. And it won't take us very long, and it will be somewhat fun, hopefully, for you guys. So I'm going to stop this recording at this point because I don't need to have this part.